Good afternoon and welcome to How to Select a Cranberry Ingredient for Urinary Tract Support. I'm Jalissa Catalan, editor of Whole Foods Magazine.
Hi, good afternoon, everybody. My name is Sherry Torkos. I'm a pharmacist and health author, and I'd like to thank you all for taking time out of your busy days as we're leading up to the holiday weekend to spend this time with us while we talk about the role of cranberry for urinary tract support. Just a little bit about my background. I've been practicing pharmacy for about 25 years now, and my type of practice is more holistically oriented in that when I'm working with patients, I really strive to help educate them on the role of preventative strategies as well as managing some of the acute conditions that people face. So I've been interested in cranberry and its ability to prevent urinary tract infections, support urinary tract health for many years. I actually did some research when I was working on Health Encyclopedia many years ago, and I was quite impressed when I came across the body of evidence backing cranberry. And of course, working as a pharmacist, I do see a lot of folks on a regular basis coming in, those that are struggling with bladder infections and very keen and interested in finding strategies for prevention. So urinary tract infections, a very common infection, actually the second most common infection that women get. They affect millions of people every year, and they also represent a significant burden to both the healthcare system and also to loss of work days. For anybody that's never had a urinary tract infection, the symptoms are quite unpleasant, the frequency, the urgency, the burning, and the pain. Women are particularly prone to getting urinary tract infections. It's estimated that about 50% of women will get a urinary tract infection in their lifetime, and about 20% of women will get them recurrently, and 30% of women who have a urinary tract infection annually will have a recurrence. So it can be very distressing. I deal with women and some men as well that come in, and it almost becomes a bit of a vicious cycle for them because women may get a urinary tract infection, have to take an antibiotic, then they get a yeast infection or some type of secondary infection or upset stomach and diarrhea, and then they need another medication. And so this is again where I think that the ability to use cranberry as a preventative can be very meaningful because not only can it reduce the need for antibiotics, but it can also hopefully prevent some of these secondary issues that people encounter when they take antibiotics. About 8.1 million visits to healthcare providers are attributed annually to UTIs. There are about 40 million cases of these infections each year. Some people will try to self-medicate to treat them. Once a bladder infection, though, occurs, most likely it does need antibiotics. Sometimes catching it early on, there are some strategies that may help prevent it from fully developing, but typically once one occurs, a person needs to see their doctor and get an antibiotic. It's estimated over $1 billion are spent every year on urinary tract infections, and that can include the hospitalizations and the cost of doctor's visits and medications. Now, we tend to think of UTIs as more of a female-related issue, but they can occur in men as well. Typically, men aren't at risk of UTIs until they experience enlargement of the prostate gland later in life. However, there are certain circumstances where they can occur more frequently, such as those that have diabetes or a compromised immune system. I would say one of the biggest challenges when it comes to treating urinary tract infections is this whole issue of antibiotic resistance. We have a dilemma, a global dilemma occurring where we have this antibiotic resistance, a situation where the drugs that we used to use and that were quite effective for managing these types of infections are becoming less effective, and there are more and more cases of antibiotic resistance and superbugs where the bugs are actually getting stronger than the drugs. and it's something that has occurred, gradually over a period of decades, where these organisms, they morph and they adapt to the drugs. And this is becoming quite problematic, because now we have to use more and more powerful drugs, and sometimes when we use these powerful broad spectrum antibiotic drugs, they can lead to other problems. As I mentioned thrush earlier, but there are other issues as well, such as C. diff and some of these super infections that can be very challenging and further lead to the demise of a person's health. So a little bit about the history of cranberry for urinary tract health. Folks that are listening in North America, we know cranberry has always been part of the traditional Thanksgiving feast and holiday time. Cranberry, though, has been recognized for its ability to support a number of aspects of health for hundreds of years, going back to the early days of the first settlers to North America, where cranberry was consumed by sailors as a method of preventing the condition scurvy, which was caused by vitamin C deficiency. In the mid-1700s, cranberry was found to, or discovered actually, to have these diuretic properties. It had long been thought that cranberry there might be something in it that can help to keep the bladder healthy. There was some ancient wisdom, and it wasn't until researchers started to study cranberry they found in the mid-1700s it had these diuretic properties. Later on in the 1800s, it was identified that cranberry contains a compound called hippuric acid, and so they used to think that cranberry was effective by acidifying the urine. It really wasn't until the mid-90s where researchers, in particular Dr. Amy Howell, who's with Rutgers University, she identified that there are these condensed tannins, or these proanthocyanidins, or PACs for short, that work. They're naturally present in cranberry, and they actually change the structure of the bacteria so that they can't adhere to the bladder wall. So it's really quite a remarkable mechanism. Cranberry doesn't kill bacteria as antibiotics do. It actually morphs and changes the bacteria, kind of rendering the bacteria unable to set up camp in the bladder and create an infection. So it's really a fascinating and novel mechanism of action. There are there's been quite a few studies actually looking at this mechanism of action, and initially it was thought just to have this effect on E. coli, which is one of the primary organisms attributed to UTIs, but now we know that cranberry can also inhibit other bacteria like Proteus mirabilis, Staph aureus, Klebsiella, Enterobacter, and Pseudomonas aeruginosa, which are some other bacteria involved in causing infections. Now, I didn't put this on the slide, but there are some other mechanisms that have been also investigated by cranberry researchers, and they've discovered that the PACs in cranberry, they might also have an ability to turn on production of compounds called GALT, G-A-L-T, which have these immune boosting and anti-adhesion properties. And there's also some preliminary research that shows some chemical changes that cranberry can yield in the urinary tract to keep bacteria away from causing infection. Now, for folks listening in that are working in the retail environment, selling cranberry products in health food stores or holistic pharmacies, you'll know that cranberry has performed quite well as a dietary supplement. It's been consistently ranked as a solid performer and one of the top selling supplements in the United States. It's enjoyed some double-digit growth over the last several years. And if we look at the total market size, it's estimated to be over $100 million and growing at a consistent level. Now, when it comes to choosing a cranberry product for bladder health, there is some confusion here. There have been some negative reports in the media. You may have heard over the last year or so, there have been a few reports, headlines coming out saying cranberry doesn't work. And that's because some of the studies that have looked at the effects of cranberry have looked at cranberry juice cocktail or cranberry juice powders. There really are so many different types of cranberry products and supplements on the market, and they do vary greatly in their quality, in the amount of PACs, again, those active compounds of proanthocyanidins that they contain. And I think this has led to a little bit of confusion in the marketplace because, again, some studies have found cranberry not to be effective. And I think this really drives home the importance when you're selecting supplements or recommending them for your patients or your customers. It's important to look for products that have been clinically studied, shown to be efficacious, and also safe. As I mentioned, many of the commercial products out there have some challenges. There are cranberry juice powders where the way in which they are formulated, they get destroyed by the stomach acid and are not able to be fully utilized and get to the urinary tract system where they need to be. And some of the challenges with some of the other products out there, such as cranberry juice cocktail, is that it contains a lot of sugar and calories and not a consistently good amount of the PACs to have a therapeutic effect. So this is what I think are some of the key attributes to look for when you want to select a cranberry ingredient. First and foremost, clinical research. Clinical research showing that the product works. And the gold standard in the medical community is to have double-blind, placebo-controlled studies where the cranberry product is compared to a placebo, and you are looking at a study population of individuals that are prone to bladder infections, and hopefully the test material is able to deliver a result. Having a standardized level of these active compounds, the PACs, is also really important so that you know a person taking the product is going to get that consistent amount of active ingredients. And you also want a delivery system that is going to protect the active ingredients so that they don't get destroyed by the harsh stomach acid. Now this shows you a little bit, this table shows the different types of cranberry ingredients, some of the more common products that are out there on the market. We're going to be zeroing in on the evidence behind Cran-Max, and just for comparison's sake, you can see that Cran-Max is actually quite different from a lot of the other cranberry products out there in that it's a whole fruit concentrate. It's made from all of the parts of the cranberry, the juice, the skin, the seeds, the pulp, and the fiber. And manufacturers actually developed this patented technology called BioShield, which protects the actives from being destroyed by stomach acid. It has a consistent amount of these active compounds, 7.2% of the standardized PACs. And because of the unique delivery system called BioShield, it has a bit of a time-released effect. So you just need to take one dosage a day, which is great for compliance. It's much easier when you can get your customers or patients to take something once a day versus having to take a product 2, 3, or 4 times a day. Cran-Max is also the ingredient that has really set the standard, the gold standard, in that it's backed by consistently positive clinical research. So as I mentioned, Cran-Max is made from 100% cranberry fruit solids. It delivers 3 times greater antioxidant activity than just cranberry juice alone, and it also contains that fiber. It's made with a patented process, that BioShield technology, and there's no harsh chemicals, no solvents, preservatives, sugars, water, flavorings, dyes that are added to the ingredient. So that has yielded this product which is highly effective and I'll actually show you, go through some of the clinical research on Cran-Max. It's actually been found to be comparable in benefits to some of the commonly prescribed antibiotics for treating UTIs. Now, over the last couple of years, researchers have also looked at the fact that there may be some hidden packs in the Cran-Max product due to the amount of fiber and the way that the cranberry products are typically tested. And so these insoluble packs that were previously undetectable by the industry standard methods have now been looked at more closely, and there are some new testing methods that have been developed and conducted by an independent laboratory, which has shed some light on some of the hidden packs that are found in Cran-Max. And as I mentioned earlier, one of the unique features with the Cran-Max ingredient is that it has this patented BioShield technology, which is just using all the best things in nature, all the parts of the cranberry, the seeds, the pulp, the skin, the juice, the fiber. The plant fibers actually form this matrix, this lignin cellulose matrix that naturally protect the packs, the bioactives, from the stomach acid, and also acts as a slow release delivery system to get the product through the digestive tract where it needs to be. It's released over a 12 to 16 hour period of time, and as a result, a number of both in vitro and vivo human clinical studies have shown that Cran-Max is a superior ingredient because of the BioShield technology, and also because of both the evident packs and some of the hidden packs that are in the product. So just to give you a little bit of background about some of the clinical research that's been conducted on Cran-Max. Again, the clinical research is just so important because it gives credibility and validity to the use of something like this for the prevention of bladder infections. I think it's really important because for somebody who has suffered with bladder infections and is interested in taking something preventatively, if they're taking a product and they don't get benefits, then they're going to end up having to take an antibiotic. And I think consumers can have good confidence in what they get with the Cran-Max because it has been the subject of a number of clinical studies. So one of the more recent studies, this was published in the Archives of Internal Medicine. This was a randomized double-blind study done at a few test sites of women that had recurrent urinary tract infections, and they were deemed to be eligible for the study if they'd had 3 or more in the previous year. So as you can imagine, just having 3 or more infections in a year, that can be really distressing because often, again, they need to be treated with antibiotics, and then it's time away from work and then side effects of antibiotics. So this group involved 221 premenopausal women, and they were given the antibiotic combination Trimethoprim and sulfamethoxazole. That's what those letters are, the TMP and SMX. That stands for Trimethoprim sulfamethoxazole. They were given that twice daily, or Cran-Max for 12-month period of time. And the researchers were looking, the primary outcome was the number of urinary tract infections, and they were also looking at antibiotic resistance and tolerability. Now, the mean number of patients that developed a UTI was 1.8 versus 4, and that's the average number of UTIs over 12 months. And the mean proportion of patients with at least one symptomatic UTI was 71% versus 78%. So what they found in this study is that the efficacy, the time to first occurrence, was not significantly different between the two groups, and the efficacy was comparable, but where there was a big difference was in the incidence of bacteriuria, which is having bacteria in the urine. The individuals that were taking the antibiotic actually had a significantly greater amount of bacteria in the urine. So the antibiotic was slightly more effective, but yet it led to this problem with antibiotic resistance. The Cran-Max was very well tolerated, whereas those that were given the antibiotics did experience some side effects. Now, this is a study that was done on a group of individuals, 137 women that had, again, recurrent urinary tract infections. and they were looking at the effect of Cran-Max versus just Trimethoprim. Trimethoprim is a drug that we sometimes give to women regularly for prevention over a 6-month period of time. And what they found here again is that the time to the first occurrence was not really significant different between the two groups, and that the efficacy was comparable. The efficacy of the Cran-Max was comparable to the antibiotics for prevention. This study was done in a group of individuals that had experienced spinal cord injuries, and they had neurogenic bladders. So patients that have had spinal cord injuries or that are catheterized due to having paralysis or MS, using catheters regularly introduces the risk of bacteria getting into the urethra. So this is really a group of high-risk patients for developing bladder infections. And so this study was really interesting and significant in that they were able to demonstrate the benefit of using Cran-Max in this group. I believe it was a group of veterans in this particular study that were previously experiencing frequent urinary tract infections. There was actually a 60% reduction in both the number of UTIs and the subjects that experienced any UTI. And yes, as I mentioned, this was the spinal cord injury unit of the Veterans Administration Hospital in Massachusetts. This was an interesting study done in France on the ability of a single postcoital dose of Cran-Max versus generic cranberry product versus placebo to prevent bladder infections. Now we know for some women intercourse is a precipitating factor in causing a bladder infection. So researchers wanted to see what would happen if they just gave a single dose of Cran-Max after intercourse. Would that have the ability to reduce the risk of getting a urinary tract infection in these women that were identified to have a history of recurrent urinary tract infections? And in fact, they did find that those given the Cran-Max had a significantly lower risk of UTIs. And this is just with, again, one single dose of the product taken after intercourse. This is one of the earliest studies that was done on Cran-Max and published in, and again, a very reputable journal, the Canadian Journal of Urology. In this study, they looked at a group of 150 sexually active women. It was a double-blind, placebo-controlled study, and they compared the effects of Cran-Max to pure cranberry juice, and that was the unsweetened, not the juice cocktail like we're used to seeing in the grocery store, but pure cranberry juice versus placebo. And they found that the Cran-Max group had the least occurrence of urinary tract infections during the 12-month period, and that it was not only the most effective, but it was also the most cost-effective method of preventing urinary tract infections. And they looked at the cost of the product versus pure cranberry juice, which is quite expensive. And I should mention, of course, if anyone's ever had pure cranberry juice, it tends to be a little bit unpalatable because it can be quite tart. So just to give you an idea of how the product should be taken and used, generally well tolerated, no known adverse effects. It contains just pure cranberry, again, on this juice, the skin, the seeds, the pulp, and the fiber. So unless somebody has an allergy or intolerance to cranberry, there should be no problem. There's a potential interaction, though, with Cran-Max or cranberry products and blood thinning medications. It may have a slight blood thinning effect, so I always tell patients if they are on blood thinners just to be cautious, make sure they're being monitored by their doctor. Unlike many other natural products and drugs, this is one thing that is very safe to use in pregnancy and breastfeeding, and it's a convenient dosage of just 500 milligrams once daily. So I thought it would be good to also throw in a few tips to share with customers or patients that you may be talking to that experience recurrent bladder infections. Really important to stay well hydrated, to drink lots of fluids. Whenever the urine becomes more concentrated, if a person's not voiding regularly, for example, if they're just holding on to their urine, resisting the urge to go, that can increase the likelihood of developing a problem. So encouraging lots of fluids early in the day, of course not before bedtime because that can cause nighttime weakening. Some simple things as well that women were always taught from our mothers as we're growing up, but perhaps sometimes this message might not be out there, that it's important after voiding to wipe from front to back, and the reason being that you don't want to introduce bacteria from the rectal area into the urethra because the rectal area is home to E. coli bacteria, which is one of the more common bacteria that cause infections. Wearing cotton underwear, undergarments is important as well, so it's breathable, it's helping to keep moisture away from the body, and also to change out of wet bathing suits and workout gear as quickly as possible so that there's, again, less risk of bacteria growing in that area. And as a complementary approach, I also do recommend, especially if women have taken courses of antibiotics, to consider taking probiotic supplements to replenish the beneficial bacteria, because one course of an antibiotic can affect a person's normal microflora levels for months afterwards. And we know that diarrhea and thrush, those are common consequences of getting antibiotics. We can reduce that problem by encouraging folks to take probiotics regularly. So just to summarize, bladder infections, UTIs, very common and preventable infection. Antibiotic use, we want to try to reduce using antibiotics as much as possible because of the risk of resistance and side effects and secondary infections such as Candida. When we look at the cranberry landscape, Cran-Max as an ingredient really stands out above all of the other cranberry products out there in that it is the most effective and most cost-effective strategy for prevention. Compared to other cranberry supplements, it's also the most widely studied. It's very safe and well tolerated. And, you know, again, encourage your customers or people that you're interacting with to help incorporate some of those other lifestyle measures that can be helpful for prevention. So I'd like to thank Whole Foods Magazine and Jalissa, who is moderating, for inviting me to share some thoughts about cranberry and its role for urinary tract health. And I'd also like to thank the folks at Proprietary Nutritionals and Pharmachem Laboratories for presenting me with the opportunity. Have a great day.
Yeah, we'd like to thank Cran-Max and Pharmachem Laboratories for partnering with us on this informational webinar, and thank you to you, Sherry, for sharing your knowledge. And of course, a special thanks to you, our listeners, for participating today. You will be able to access a recording of this webinar on our website at wholefoodsmagazine.com. Thank you.